Our skin is by far our biggest organ and arguably our most important. After all, our skin is our first line of defense against infection. So anytime you get a wound, it's serious business, especially if you're one of the millions of people dealing with serious wounds. If that's you, listen up, because your wound care routine just got a lot less traumatic.
Oh, I love the blues. I kind of grew up around the blues. I live it. I love listening to it. I love playing it. I went to high school in New Orleans, went to Berklee College of Music in Boston, graduated with a degree in instrumental performance. I was a professional musician, played all over the United States, and I'd like to get back to that. I've also been in the construction trades and built some pretty major projects all over the United States. I used to be in great health, but in the year 2000, I came down with pancreatitis, and it really screwed me up bad. My diabetes went out of control pretty bad and gained a lot of weight, had a lot of medical problems. In 2009, I had a pretty horrific diabetic wound on my right foot, and I became permanently disabled. I have not worked since 2009, and I've been fighting a multitude of wounds on my feet and my legs, and wounds from various falls and slips from being handicapped. I just want to go back to being a regular person.
Everyone has the occasional minor bump or bruise that we slap a bandage on. But if you underwent surgery, or you had an accidental burn injury, or you have a specific wound-related medical issue like Terry, then you've had to deal with advanced wound care. Turns out that a lot of people, an estimated 17 million of us, will struggle with the difficulties of wound care this year. So joining us to talk more about wound care is Terry Young, along with registered nurse and board-certified wound care specialist, Dot Weir. Thank you so much for joining us. We have a lot of important things to talk about today. So Terry, I'd love to start with you. Tell us a little bit about the struggles that you deal with when it comes to wound care.
First and foremost, there's a whole lot of pain and physical and psychological trauma associated with all that. Your whole life changes because you become a professional patient. You can't work anymore, you're at home, you're not making any money. All phases of your life change in the most profound way.
I want to thank you, first of all, for coming and sharing, because I think that's very important for everybody out there. So thank you so much, Terry. So Dot, I know that you've been working as a wound care specialist for now almost 40 years. Mm-hmm. You work on the team that helps take care of Terry. In your opinion, what are some of the challenges that you see with wound care on the medical side?
Well, the medical side brings all kinds of challenges. First and foremost, we're dealing with a disease state that has caused a change in somebody's skin, or they have developed a wound or had a trauma that now their disease state takes over their ability to heal normally. Mm-hmm. All of us are used to healing thoughtlessly, that we don't have to put any effort into it. But folks like Terry, when they have diabetes and other disease states, there's many reasons that people have wounds, are challenged with healing. And so they have this necessity to have dressing changes done on a daily basis and create an environment for healing that we have to emphasize to them is necessary.
And I know, Terry, you've talked a little bit to me personally about how you can make advancements and you feel like you're healing, and then so simply you can take one step forward and then two steps back.
With most normal people, it just takes a few days for a wound to heal. It might take me weeks or months. In some cases on my feet, it's taken years. So any setback is horrendous, and any advancement with different kinds of medications or treatments or bandages helps so much for somebody like me. I mean, you don't know it until you've lived it.
Truly, it's been an emotional and psychological struggle for you until you came across this product. It's called Safetac, right, Doc? Can you tell me exactly what is Safetac?
Safetac is a technology that is our first introduction into reduced pain and trauma with wound healing and with dressing changes. Something we had thought about before, but they really brought it to the forefront of people who do wound care like I do, to have us start thinking about how much we're hurting these people when we change their dressings. So it's everyone has had something adhesive on their skin, and we know that when it pulls up, it pulls hair, it's pulling on skin cells cells. So doing that repeatedly, like with someone like Terry who has to do frequent dressing changes, 1 or 2 or 3 times a week, you're going to strip the skin and cause injury. So with this, it's adhering with silicone, and the silicone sort of goes down in and amongst the skin cells so that when you take it off, you're not stripping anything. The silicone does not adhere to moisture, so it doesn't pull off the healthy tissues that are trying to grow in the wound. And then it also creates a moist environment by absorbing the exudate, but protecting the peri-wound skin. So it's not pooling drainage, or we call it exudate, but drainage on the skin, which will further damage the surrounding skin. It causes a situation called maceration, which is just over-wetting of the skin, but it can destroy good, healthy skin, so it's something that helps us to prevent that as well. Something I've always felt about wound care is we only have one opportunity to hurt somebody. If it hurts when we do it, they're not going to trust us. They're not going to want to come back. And so if we can use something that will reduce that pain at dressing changes, it won't be something that they dread.
So is this something that only you have access to at the hospital?
No, actually, that's the beauty of it. It is now a product that is available to the general public. It's the first time this advanced type of dressing is available at retail pharmacies so that patients can have access to it certainly with the guidance of their healthcare professional, but have access to at their local drugstore.
With this sort of a product, is it helpful with the pain relief? Does it require less pain medication potentially if you're relieving the pain?
Well, there's absolutely a lot less pain by using this product. I take it off, I clean up the wound, I put it back on, and life goes on.
And so as a result of less pain with dressing changes, there was a study done that actually looked at the fact that over 70% of the folks that were using this technology took less pain medication. And pain medication, while it is a necessary evil, it affects your whole life. Your ability to drive, work, you're sleepy all the time, your appetite is less. So the ripple effect of pain definitely negatively impacts wound healing.
So how has it improved for you now that you have Safetac?
Well, it makes my daily care so much easier. It's to the point where I can clean it up at home, put something clean and sterile on, and I know I'm not damaging something that I've spent a lot of money trying to get to heal, that I don't go back to square one all over again. Makes me much more confident to take care of a problem at home on a daily basis.
Thank you so much, Terry, for joining us, and Dot, thank you for all the great information. Where can we learn more about Safetac?
Well, you can go to safetacathome.com, and that's Safetac, TAC, at home.com.
Thank you so much. Again, you can go to safetacathome.com to find more information about their technology, or just log on to accesshealth.tv.